Hi, this is Dr. VJ. Today I'm going to be covering how to do a brief physical exam to evaluate for catatonia on the CL service. That's quick and easy. So if you actually Google the Bush-Francis rating scale and pull it up, on the last page, which you may have missed if you haven't really been looking closely for it, there is a 9-step physical exam instruction guide, which basically is where I've got this information from, and we'll be going over these steps. And it's really impractical to be carrying around the whole list of the Bush-Francis scale and kind of checking it off one by one. Rather, it's helpful to kind of have this framework whereby you can kind of go through these steps and then afterwards go back to the Bush-Francis scale and kind of put down your recordings. So the first step is simply to observe the patient. And from this alone, you can kind of cover a few different things on the Bush-Francis scale, including like immobility, stupor, staring, and excitement. And these items are all defined for you on the actual Bush-Francis scale. And to differentiate between a stereotypy and mannerisms, which are two other items on the scale that you can assess with visual observation. Stereotypy is a repetitive, non-goal-directed activity, and the abnormality is not inherent in the act itself, but in the frequency. Could involve like finger tapping or like patting yourself, for example. Mannerisms, by the other hand, are odd, purposeful movements, and the abnormality is inherent in the act itself, which could include like saluting passerbys or walking on your tiptoes for no apparent reason. And these are two items that you can quickly assess with observation. And then also you can be checking for any abnormal speech patterns that might be present just on observation or having a brief conversation with the patient. The next step is to simply just scratch your head, and this is actually checking for one thing on the scale known as echopraxia, which is mimicking an examiner's movements. And this is just a quick and easy test, and if the item is positive, the patient will actually attempt to scratch their own head in response to seeing you scratch your head in an exaggerated way. Step 3 is the arm exam, and this is probably the item that takes the longest on the whole physical exam steps. So basically you'll attempt to move the upper extremities around, alternating between heavier and lighter forces. You're instructing the patient to keep their arm loose, and you can be checking for like rigidity with this, also waxy flexibility and posturing. So waxy flexibility and posturing are actually similar, but two different things actually. So waxy flexibility is kind of like, I think of it as like a candle made out of wax. As you're trying to reposition a patient, their arm might have some initial resistance to the force. However, with increased pressure or like continued pressure, the arm does eventually give out and will allow itself to be repositioned. Kind of like the bending of a candle, where it's kind of difficult at first to bend it, but then as you keep applying force, the candle does bend. This is distinct from posturing, which is kind of like the maintenance of a specific posture after you reposition the patient. This is also known as catalepsy, not to be confused with cataplexy, which is something seen in narcolepsy. So you can see the woman on the right there is exhibiting some posturing, which is some maintenance of some abnormal postures against gravity. And with the arm exam, you can also be checking for negativism, which is kind of like this refusal to cooperate with the exam and doing the opposite of what is asked. So Gegenhalten and Mitgehen can also be assessed for with the arm exam, and Gegenhalten refers to increased resistance in the rigidity that has increased force. So with increased force, there's more resistance. And that's why you are assessing the movements with alternating lighter and heavier forces. You can assess for that. Mitgehen, on the other hand, is when you place a finger beneath the hand and instruct the patient to say, instruct the patient, do not let me raise your arm. And then with that gentle pressure from one finger beneath the hand, you attempt to gently raise their arm. A normal response would be to not allow the patient's arm to be, the patient does not allow their arm to be raised. But with catatonia, they will kind of not comply with that instruction and will allow their arm to be raised, and oftentimes that arm will just continue to be raised all the way up even after you kind of remove the pressure. That would be a positive Mitgehens. Step 4 is to check for ambitendency, and this is really when you kind of like try to trick the patient into getting confused, and you do this by sort of like extending your hand to them and saying, do not shake my hand. And this is confusing to the patient because visually they see you extending your hand in an attempt to like shake their hand, but you're telling them not to, so they get kind of stuck, caught in between, and they look confused. They might like outstretch their hand, but like kind of look with a confused look on their face and not really know what to do. Step 5 is to check for automatic obedience, and this is something on the scale that indicates the patient automatically complies with whatever you ask, even though it might be something negative. For example, you do this by reaching into your pocket and saying, stick out your tongue, I want to stick a pin in it. And normally a patient might stick out their tongue, but as soon as they hear you say, I'm going to stick a pin in it, they kind of like look at you like, oh, I don't want you to do that, and retract their tongue back in their mouth. But a catatonic patient might kind of miss that and will automatically comply and continue sticking out their tongue even though you've told them you're going to put a pin in it. And then step 6 is pretty simple. You just stroke the inside of their palm, your finger, and check for a grasp reflex. And then the final step is to chart review the patient for the past 24 hours. And this will hit on a number of items on the scale, including like withdrawal when you're checking for PO intake and activity levels, vital sign abnormalities, and any behavioral incidents which could indicate combativeness or impulsivity.